Time is 7:35, and this Mental Health Monday, we're talking to a doctor duo helping parents and educators to normalize conversations about mental health with their kids. Joining us live in studio to talk about their new children's book, Psychiatry for Kids, Dr. Nguyen and Dr. Pham, co-creators of the Medical School for Kids book series. Thanks for joining us today.
Of course. Thank you so much for having us.
Talk, first of all, how you guys got together and started this book and came up with the idea. How'd that start?
Absolutely.
Brandon, start us off.
Yeah, absolutely. We both grew up in Orange County. We met in high school, where we grew up in Huntington Beach. We went to UCLA for college. We went our separate ways for medical school, but we got together during Betty's first year of medical school. We started our children's book series, Medical School for Kids, 2 years ago, and that was a big year for us because we also got engaged that year. And since then, in 2 years, we've published more than 25 books in our Medical School for Kids book series, and one of our most empowering books is the Psychiatry for Kids book, which we're so happy to discuss
Betty,
today.
tell us about it.
Yes.
What can we learn from this book?
Of course. So Psychiatry for Kids talks about different symptoms and signs of mental health conditions, including anxiety, depression, ADHD, obsessive compulsive disorder. And we also talk about behavioral developmental disabilities such as autism and Down syndrome as well. So we really try to empower kids to see these symptoms and seek help if they're having these symptoms.
So the idea is to get the kids to see the symptoms and relay them to the parents. And that's something that's overlooked sometimes, isn't it?
That's right. Yeah, mental health, unfortunately, is very stigmatized, and it's something that a lot of patients don't talk about. In fact, patients are much less likely to seek help for a mental health illness than a physical illness, and yet mental health can be just as important to someone's overall health as their physical well-being.
Sure.
And so our goal with these kids' books is to raise awareness about the importance of mental health and to encourage kids to seek help and support when they need it.
We live in such challenging times for kids and parents. What are the big, I think of cell phones and social media that really come to my mind. What do you think, Betty?
Absolutely. I think there are ways that adults and parents can help support mental health in children. It's so important to have conversations about mental health, to normalize these conversations, and to have parents check in on their kids about how they're feeling emotionally. I think it's also important to have healthy habits. For instance, limiting screen time, spending time outdoors, and having a routine bedtime schedule. And lastly, it's important to be role models. So parents are the role models for children, and children look to them to learn how to cope with their emotions.
One thing you mentioned, the activity portion of it, exercise. How important is exercise, Brandon?
So incredibly important. These exercise, good diet, sleep, all of these are so important, and these habits start when we're children, when we're adolescents, because we keep these habits for the rest of our life. So it's so important to be a good role model and prioritize these things.
Right. And what should parents and teachers be doing when, say, a child comes forward concerned about some of these symptoms?
Yeah.
Absolutely. I think listening in a non-judgmental way is so important. Kids want to feel that they have someone who is trusted, that they can turn to and open up about the most sensitive issues. And being available, having a listening ear, I think that is so understated today.
At what age would symptoms start to show up where a child could, respond to a parent or let the parent know there's something going on? What age would you look for?
I think it's never too early to reach out to an adult that a child trusts, whether it's a teacher, it's a parent, a relative. If they're not feeling well, or if there's something that's they're feeling unhappy about, or these feelings that are bothering them, they can always open up and reach out to an adult and let them know how they're feeling.
Social media, TikTok, and cell phones in the news a lot lately. Schools trying to ban that kind of stuff. What age would you guys recommend a child get a cell phone? A smartphone, I should say, not just a cell phone.
I think a lot of those decisions will be up to the parent, and the days and age have changed a lot, but I think definitely emphasizing the importance of outdoors, not constantly being glued to a screen, is very important, especially in this day and age where TikTok and social media, Facebook are so rampant everywhere.
And it literally can change the brain patterns or the brain activity, doesn't it? Change how your brain works?
Of course. So your brain is highly sensitive. So if you're exercising, it's releasing endorphins, which helps boost happiness and mood. If you're glued to a screen and comparing yourself to things that you're seeing on the internet, it can easily lead down to a path of negativity.
Yeah, it's tough. It's tough for kids. It's tough for parents out there. We wanted to, let me just talk about one more thing. 25 books written so far. That's pretty impressive. Is more on the way?
That's right, yeah. In 2 years, we've published 25 books, and we have many different other medical specialties that we have planned for the future. And we've expanded to different professions as well. We've released nurses for kids, as well as plans for other essential healthcare workers in the future.
And this latest book, Psychiatry for Kids. Betty Nguyen and Brandon Pham, thanks for joining us today. Great stuff. And boy, we got to get the word out for these kids because these are tough times.
Thank you so much for having us, John.
Thank you so much for having us.
Thank you for joining us.